Hi, welcome to the Healthy Life channel. Many people find out they have diabetes too late. In fact, the sooner you detect the symptoms and signs of this disease, the greater your chances of avoiding dangerous diabetes complications. Even so, not a few people who do not understand the symptoms of diabetes, so this disease is neglected and not detected from the beginning. Diabetes is most commonly experienced by people over the age of 15. However, only 30% show symptoms and are officially diagnosed. Most people with diabetes, especially type 2 diabetes, often do not feel the initial symptoms. They only find out about their condition after accidentally checking their blood sugar. This is common because the early symptoms of type 2 diabetes develop slowly, unlike type 1 diabetes where symptoms appear quickly. In fact, your chances of getting the right treatment will be greater if the disease is detected early. That way, you can minimize the risk of serious complications. Here are some early signs of diabetes that you need to be aware of. 1. Hunger. Hunger is a very common, but often underestimated, sign of diabetes. This condition usually occurs when people with diabetes have just eaten a heavy meal. In the body, food is converted into glucose. Glucose will then be used as an energy source for every cell, tissue, and organ in your body. The hormone insulin is responsible for carrying out this process. In people with diabetes, there are problems with insulin production or the body's ability to respond to insulin. As a result, the process of converting glucose into energy is hampered. Your energy needs are not met, even though you have eaten. The body, which feels that it has not received energy, will send signals to eat again. In the medical world, this symptom of diabetes is called polyphagia. It is characterized by excessive hunger or an unusual increase in appetite. 2. Drastic weight loss. Drastic weight loss can be an early symptom of diabetes. Weight loss is said to be drastic if the loss has been approximately more than 5% of your total body weight. Normally, the body will use glycogen, glucose, as an energy source. However, due to the problem of insulin not being able to process the change of glucose into energy, the body starts to look for other sources of energy, namely fat and protein. The body will continue to try to break down fat and muscle for energy. This process of breaking down muscle and fat is what makes you lose weight and makes diabetics thin. It should be noted that the muscles in your body contribute to the average body weight in men as much as 45%, while in women 36%. Therefore, the loss of muscle mass will have a major impact on total body weight. 3. Frequent thirst. A typical symptom of diabetes is easy thirst or polydipsia. This thirst is different from normal thirst because it will not go away even if you drink. Under normal conditions, sugar in the blood will be filtered by the kidneys and absorbed back into the blood. However, if the blood sugar level is very high, the kidneys cannot absorb all the sugar, so the sugar will accumulate in the urine. Urine that is high in sugar will have a high osmotic pressure that attracts more water molecules. Over time, more water is attracted to the urine and the frequency of urination increases. Both conditions then lead to dehydration and the body sends thirst signals to the brain. In this condition, people with diabetes will become thirsty and drink more. Those are some of the signs of early diabetes that you should be aware of. If you experience these symptoms, immediately see a doctor to get further treatment. This video is for educational purposes only. If this video is useful, don't forget to like and subscribe so you don't miss other videos.